Hi everyone, I'm Dr. Nestor Rodriguez, board certified physician and co-founder of Carbon World Health. And nowadays, one of the most commonly asked questions is, what's your favorite peptide? Honestly, that question highlights one of the biggest misconceptions about peptide medicine today. Peptides aren't about popularity, they're not a trend, and they're not one size fits all. At Carbon World Health, we categorize peptides and we use them strategically to help our clients achieve their goals based on what their body needs. A lot of what you see on social media today is people talking about individual peptides or specifically what worked for them. However, biology does not work that way. When peptides are used randomly or without structure, you get inconsistent results, you get plateaus, or even side effects. It's not that the peptides didn't work, it's that you didn't stack them appropriately and that you didn't use them for your particular goals. Instead of asking what peptide is best, we ask, what category does this patient need support first? Broadly speaking, peptide therapy can be divided into 4 categories. 1 is regulation and anti-inflammatory. 2 is metabolic and body composition. 3 is performance and growth signaling. And the 4th category is regenerative and tissue repair. And we move through all these strategically. Category 1 is regulation and anti-inflammatory support. And this is foundational. If the body's inflamed, if it's stressed out, if it's metabolically dysregulated or immune activated, advanced therapies won't work as expected. Examples in this category include BPC 157, often used for gut integrity and focal tissue healing, thymosin alpha 1 for immune support, and GHK-Cu for cellular signaling and tissue support. This phase is all about stabilizing the system, reducing inflammatory noise, improving cellular communication, helping the body become responsive again. Think of it as preparing the soil before planting the seed. Category 2 is metabolic and body composition support. Once the foundation is stable, we now begin to address metabolism. These include peptides that influence insulin sensitivity, appetite signaling, and energy regulation. Examples include GLPs like semaglutide, tirzepatide, or even the newer one, rituximab. This category supports fat loss, glucose regulation, appetite control, and metabolic flexibility. But again, if inflammation and hormonal regulation is not controlled first, then these metabolic peptides may underperform. Category 3 is performance and growth signaling. This phase is all about optimization. Here we work on growth hormone signaling, recovery capacity, mitochondrial efficiency, and resilience. Examples include sermorelin, ipamorelin, tesamorelin, or actual HGH. It also includes NAD+, or MOTS-C. Patients often see improvement in sleep, recovery from training, body composition, energy, and resilience. But this only works because the first layers were addressed early on. Category 4 is regenerative and advanced tissue repair. This is where we get advanced and highly individualized. These peptides are often used for injury recovery, post-surgical, aesthetic purposes, and longevity mindset. Examples include now adding TB500 to your BPC 157 and also adding GHK-Cu for scar healing. These interventions require appropriate timing, appropriate dosing, and medical supervision. Skipping straight to these without addressing the foundational categories is why oftentimes people don't see the optimized result that they're looking for. At Carbon World Health, we translate these categories into what we call a good, better, or best game plan. The good is foundational regulation, the better is structural optimization, and the best is more comprehensive regenerative therapies. And what I emphasize to my clients, best does not mean you have to be on it. The right level depends on your physiology, on your goals, and on your timeline. Here's the takeaway. Peptides are tools, not shortcuts. Success depends on choosing the right category at the right time and that it's personalized to your goal. So instead of asking what's the best peptide, you should ask yourself, where am I starting? What are my goals? And what does my body need at this time? If any of this resonates with you, the next step is not guessing, it's evaluation. I want you to reach out to me, schedule a consultation so I can help you come up with the best regimen that your body needs based on your goals.